So what are your thoughts on PSA screening for prostate cancer?
I wish that was a straightforward
No,
answer.
right?
People talk about screening tests for more common types of cancer, like breast cancer, colon cancer. Those are very well hammered out. Over the years, PSA, they've been trying to figure out what your break point is, who gets it, who needs it, how early. If we detect it too early, are we benefiting people by putting them through biopsies and earlier treatment? I mean, there are certainly aggressive prostate cancers, as I'm sure you know better than any of us. But there are prostate cancers that smolder along. And if you catch them too early, are we doing people favors by putting them through a biopsy, surgery, radiation, chemo, that kind of stuff?
I think it's always been interesting to me that even the guidelines aren't static. The guidelines have changed over the years, gone back and forth.
Yeah.
I think interestingly now is the focus on shared decision making.
Yes.
Having a longer conversation even before you consider PSA screening for prostate cancer.
That's right.
Talking about what to do with the results, what they mean,
Yep.
how to manage those, what would otherwise be seemingly simple blood tests. It's a more complex conversation, I think, than some of the other screenings for cancer.
It's one of those ones where ordering it's the easy part.
Yes.
What do you do in the wake of what you got?
Yeah, it is challenging, because then you've got, like you said, patients that have lower risk than you're counseling on active surveillance more for many than you are active treatment. And so it becomes a very complex conversation pretty quickly.
And even older patients, thankfully some of the guidelines point out, like if you got an older patient and you actually pick up prostate cancer, you can just observe it.
Right.
So it's not one of those cancers where we need to jump in and treat it right away. Certainly there are cases like that, but I think it's one of those things where you look at the global picture of what's going on.
Yeah. I think the other huge change in the last few years has been, PET scan for staging.
Yep.
I think it's turned some of our data on its head
a little bit,
and it's made, I think, prostate cancer staging much more accurate. I think it's affecting outcomes for sure for the better.
Absolutely.
But it does add another layer of complexity.
It does.
Much of our data is based on studies done before PET scan was available. So it's a very powerful tool to have, but it certainly makes the landscape a little trickier.
Yeah. And using your PET scan as a segue, you talk about therapies like Pluvicto and radioligand.
Yes.
And that's definitely come big into the picture for metastatic castrate resistance. I know that's like typically we refer that over to, you guys, or I think radiology does it here, but that's a relatively newer treatment, which, can certainly be very effective in the right subset of patients.
Yeah. I think, with the improvement in systemic therapies, including Pluvicto, it's kind of made a renaissance in local therapy with radiation.
Yep.
More important for some patients.
Yep.
Because the systemic treatments have gotten so much.
They've gotten very good, Joe. And even with like a diagnosis of metastatic prostate cancer, they kind of toss around phrase in the oncology world is like, that's not a cancer that we expect is going to kill you. And oftentimes it might be something else that ultimately, leads to a fatal event versus the cancer itself, because the people can survive for so long.
Correct. There's, as with many other cancers now, I think thank goodness we're managing more like a chronic disease as opposed to the mortality of a metastatic prostate cancer that we used to just always assume.
Sure. And, one thing I was surprised of when I came here is that, we are able to deliver Pluvicto because there's certain, major metropolitan centers that can't even do it. And they have to refer to bigger academic centers within the city. So having access to that is huge.
Yeah. I think from active surveillance protocols to active treatment protocols, with our urology colleagues here, having the robotics available for surgery, having the radiation equipment that we have, really being able to offer the full suite of possibilities for both local therapy and metastatic therapy.
100%.
I think patients across the board benefit.
Oh yeah. And, the guidelines in a certain sense are a little muddier than other more straightforward protocols, but we do have a ton of tools available to treat this stuff.
Yeah. It's always been, I think, that collaboration between our surgical colleagues, my radiation partner, and all of our medical oncologists is so important.
Huge.
As we've gotten more tools to treat prostate cancer, it's just become more and more of a collaborative effort. You know, we have urologists, you know, performing surgery, and then many patients still require radiation treatment along with medication from the medical oncology standpoint.
Yep.
So I think with the PSA blood test screening for prostate cancer, you know, I think it's important because many times prostate cancers are silent. You know, they don't present with symptoms. Most of my patients, their prostate cancer is detected from PSA screening.
Sure.
And a simple blood test can be so important. You know, we've seen the guidelines change over the years, and we saw, you know, the United States Preventative Task Force recommend against PSA screening more than a decade ago now. And then they changed the guidelines because we saw prostate cancer mortality rise without PSA screening. So for a simple blood test, it's really important to catch these cancers early.
Yep.
But you can't stress the shared decision making enough. You know, the importance of the test is there, but the consequences of a rising PSA. You got to understand what you're getting into before you do the screening.
Yeah. And even if like you get the patients who decide to forgo screening, which again that's a decision between you and your primary doctor usually. You know, there's obviously the signs and symptoms that we think about when you kind of read the classic textbook things. You know, maybe pain in your lower back. Maybe you've got issues like emptying your bladder. You're straining more. You find like you're dribbling or something and not being able to expel everything in your bladder. You know, the other classic tale is like you wake up multiple times a night to pee, and that's kind of the thing. You can get blood in your urine with prostate cancer. It's not the most common thing that you see.
Yeah.
Bladder cancer for sure. You know, kidney stones, those are probably higher on your radar for blood. But if you do see blood in your urine, you need to get that checked out.
Absolutely.
But those are the major things. And the other thing to know is that it's one of those cancers that has a propensity to spread to the bone. So if you've got some new lower back pain that just popped out of nowhere and no really good explanation for it, you know, that's something worth looking into for sure.
Yeah.
I don't know. What are your thoughts? Symptoms?
Well, I think probably the urinary changes. You know, there's definitely benign reasons as we get older, as men age. You know, you can have benign prostate hypertrophy.
Yep.
That, you know, BPH that can cause similar urinary changes to a prostate cancer.
Yeah.
But I think if you're noticing changes more quickly than just what would be expected as we get older,
sure.
I think that's when it's so important to bring those symptoms to the attention of your primary care doctor.
Yeah.
I think in those situations, PSA screening is very important.
Yep, absolutely. You know, I think as I was alluding to in our earlier conversations, that we tend not to think of prostate cancer, even at later advanced stages, you know, something that's going to immediately lead to a death sentence. If I can use that term, a non-medical term, I guess.
Yeah.
There are definitely a lot of treatments that we talked about. They can be very effective. They can last for years, plural. And so you do see that survival getting pushed out more and more and more.
Yep.
You know, even beyond your first line therapy, you know, you've got other lines of therapy. You've got radiation when you need it, whether it's for, you know, problem areas that are causing you, you know, symptomatic discomfort,
right,
for palliative reasons. Whether you're using radiation like in the relapse setting, like after a surgery, for example.
Correct. Yeah. And I think now in the metastatic setting, even, you know, radiation is proven to be safe and effective. And has improved survival.
Yeah, definitely in that metastatic setting, we've got one or two spots.
Yeah.
Clean those up.
You know, these are things we didn't consider.
No, we like,
you know, 10 years ago.
Why do we do that? You're on therapy.
Exactly. I think it's an exciting time for us.
Oh, big time.
Because we have so many more tools now to help patients live longer and live better, even with a prostate cancer diagnosis.
Yeah, you know, like no one wants any cancer diagnosis, but from a survivability standpoint and the tools in your toolbox, it's probably one of the better ones. Like you have a real shot at.
Yeah.
whether you beat it or not. You know, I don't think it's anything that you need to, you know, make a call too early on.
Right.